Well, most of us have our share of monthly bills, utilities, cable, car payment, but what about paying $100 a month for unlimited visits to your doctor? One Atlanta physician is banking on this idea. He no longer takes insurance. The Fox Medical Team's Beth Galvin joins us with more, and this is called direct care, Beth. So how is this different from concierge medicine?
So it's a little different from concierge medicine, Christine, in that with concierge medicine, it's more expensive usually, and you pay a yearly fee for around-the-clock access to your doctor, but you may still also need to use your insurance. With direct care, you pay a set amount with no copays or deductibles or surprise bills, but there are some pros and some cons to this model.
Last fall, Highland Urgent Care and Family Medicine's Dr. Nick Beaulieu announced to his patients that as of December 1st, he would no longer be accepting private health insurance. Instead, he told them,
I'm going to charge you $100 a month for whatever you need. You need to call me? Call. You want to text? You need to come in? I'll see you. As many times as you need to come in, it's not a problem.
They call this direct care. For $100 a month or $1,200 a year, Highland's patients will have unlimited access to primary care.
You need to come in 12 times? No worries. There's no copay to try to limit you coming in. There's no co-insurance to make it sting because you wanted to see your doctor. There's no deductible to be met.
Under the current fee-for-service model, doctors are reimbursed based on the number of patients that they treat.
We've got to see between 25 and 30 patients in an 8-hour period in order to make the quotas that are imposed upon us by employers like hospitals.
By getting rid of the insurance middlemen,
I don't have to see 30 patients a day. Right? I got to see 10. Most time when I see you, I'm going to have half an hour, 45 minutes, an hour to see you.
And I think doctors are under tremendous pressure. And it's time pressure, it's economic pressures.
Dr. Harry Hyman is a clinical professor at Georgia State University's School of Public Health, and he practiced family medicine in Marietta for 20 years.
You kind of come to a decision point whether you're going to prioritize the patients you're seeing or create more of an in and out, let's see as many people as we can.
So Dr. Hyman says he understands why some primary care doctors are moving towards concierge or direct care medicine.
But the reality is, in doing that, they're pricing out those people that need primary care the most. They're pricing out low and middle income people that can't afford that additional $1,200 a year. And I think that's very problematic.
Even with unlimited primary care, patients will still need a catastrophic health insurance plan to cover a major medical emergency or serious illness. But Dr. Beaulieu says this new model buys him and his patients more time to focus on keeping them healthy.
Seeing 30 patients a day for 7 minutes, you don't know your patients, and you really can't help, and you really can't create that connection that you need to create that produces health. We want to produce something between two people who have equal investment in the process.
And Dr. Beaulieu says the response from his patients has been pretty mixed. Some of the patients are switching to that $100 a month unlimited visits models. Others are moving to another provider because they can't or don't want to pay an additional $100 a month on top of their health insurance. And Christine, a lot of people have already picked their health insurance for the year and there's certain enrollment periods, so you can't really switch to a catastrophic right now.
Sure. It's very intriguing. I mean, I guess when you listen to the root of why he wants to do it, you do appreciate that there's someone out there who wants more out of the doctor-patient relationship, right?
Absolutely. It's more out of the doctor-patient relationship. It's more financial stability for him and his staff. It's just, for him, it works.
Yeah. Huh. Interesting. All right. Thanks so much, Beth.
Yeah.